July 7th, 2026 meeting of the Lewis and Clark County Commission. Will you please stand and join us in the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Take a minute and introduce the folks on this end of the room tonight. Starting on the far right is Roger Baltz, our Chief Administrative Officer, and TJ Murphy representing the County Attorney's Office, trying to keep us in line legally. To our my immediate right is Commissioner Candace Payne. To my immediate left is Commissioner Andy Hunthausen. I'm Tom Rolfe, Chair of the Commission this year. Next, we have Brandy Grandy, our recording secretary, who will keep track of the minutes and she makes sure that the microphones and everything are working, so it's all recorded and we can have it on our website very shortly. And then we have Jenny Chambers, who is the Director of Public Works and Planning. On the far side of the bar is a sign-in sheet. We'd like to have you leave us contact information so that we can reach you if we need to. And there's also an agenda there. All right, we're going to start off, see no consent action items today, but just regular action items. The first one is a grant application to the Substance Abuse and Mental Health Services Administration.
Good morning, Mr. Chair, members of the Commission. I'm Sarah Sandau. I'm the Grant Specialist at Lewis and Clark Public Health. Today I have before you for your consideration a grant application to the Substance Abuse and Mental Health Services Administration, SAMHSA, funding opportunity titled Behavioral Health Mobile Crisis Team Partnerships for up to $750,000 per year for 4 years. The grant period would be September 30th, 2026 through September 29th, 2030. The application is due on July 15th. The purpose of the program is to establish new or enhance existing mobile crisis response teams that serve youth, adults experiencing mental health and substance use disorder crises. Through formal cross-system partnerships, grantees will divert crisis response from law enforcement only and criminal justice pathways to the behavioral health crisis system. Mobile crisis response teams are the second pillar of the behavioral health crisis system. This is the someone to respond, bridging the gap between the 988 call center, which is someone to contact, and the crisis stabilization services, which is a safe place for help. They prevent unnecessary arrests, justice system involvement, and emergency department visits. Our goal is to get the least restrictive at the time someone needs it. Our mobile crisis response team has been active since November 2021, with St. Peter's Health managing and operating the service. As of July 1st, the 2-person team, therapist and allied support, operate 24/7 and respond in partnership with law enforcement. These community-based professionals meet individuals at their home, school, work, or out in the community to provide de-escalation, stabilization, and direct connections to ongoing care. We are currently updating our website that publicizes the data from the 3 pillars. So I have some key points that I would like to bring today for what Mobile Crisis Response Team has been up to. A few of the key points that I wanted to highlight. In the almost 5 years that the team has been active, there have been a total of 2,612 responses. If you look at specific individuals, that's 1,601 individuals, unique individuals. In this last fiscal year, which is July 1st, 2025 through June 2026, there have been 541 calls responded to, which to unique individuals have been 321. For the last 3 years, the Mobile Crisis Response Team has primarily used state grants and a Bureau of Justice Administration grant to fund the team, with billing introduced more recently. The Bureau of Justice Administration funding will end in September. While there is a sustainability plan in place for the current level of service, this specific grant would cover improvements and enhancements to the program, which include clinical supervision, a swing shift and second vehicle, and case management to connect individuals to outpatient care, medication management, and ongoing community resources, preventing future crises after the encounter. I have St. Peter's Health with me today. If I can ask Kayla to come up and say a few words. Thank you.
You bet.
Good morning. Thank you for having me. It's wonderful to be back here. Sarah did a wonderful job explaining where we're headed with this. Kayla Morris, St. Peter's Health. So I recently took over the mobile crisis response team in February. And since then, we've been working to implement what we call Mobile Crisis Response Team 2.0, which, as Sarah mentioned, is the 24/7 response model with 2 people on shift, which allows us to move away from the traditional co-responder model where a law enforcement officer is a part of your team and thus has to remain on scene the entire time, to a model where law enforcement is a responding partner, similar to how EMS and fire would also be responding partners, and don't have to remain on scene once the scene is safe and clear to do so, which allows our behavioral health professionals to spend the amount of time on scene with individuals that they need, giving them the right level of care and freeing up law enforcement. And we've seen a positive response to that. So with this grant, we would be able to expand and have a swing shift during busy times, because right now about 25% of their calls are stacked up in a queue, which means once they're on a call responding to someone, another crisis comes in and they can't even start that next crisis call until they wrap up the one they're on. And they're spending an average about 45 minutes to 90 minutes on scene with individuals. So that would allow us to have greater expansion and then also make it easier to leave the general greater Helena area and get up into Lincoln and Augusta more, because we would have the resources to do so. So I'm happy to answer any questions.
How would this help in continuing the care then? How would that tie in?
Yeah, the grant or the second?
Yeah, how would the grant add to that?
Yeah, so what the grant does is it allows us to have that financial backing. And so anything that's not covered by billable reimbursement would allow us to have a greater service area. And so right now in a fee-for-service billing model, there are some days where there's nothing going on and we can't bill for anything that day, but we still have to staff that team. And so the grant allows us to fill in the gaps there. It allows us to hire a dedicated clinical supervisor. I'm not a clinical individual. And so while I can work on the operation side, outside of having some of our other seasoned therapists help out, it would be helpful to have someone who's dedicated clinically to the program and to our team members so that they stay healthy and well as well. The grant that second team allows us to pay for that and not worry about volumes when there's slower days, which gives us about 4 years to figure out what this looks like. And hopefully by that point, the team has rebuilt its image and its branding, and it becomes well integrated in the sense that its utilization is high enough so we can support it without a grant.
Any questions from Commissioner Payne?
Over the weekend, the 4th of July celebration, I live out north of town, and all my neighbors shoot off fireworks. I find this to be really upsetting. I've got one neighbor, he's a head injury victim. He probably has some sort of PTSD. I have talked to several of our veterans and the veterans group, and one of their big concerns is, why in the heck can we shoot off all those noisy, nasty fireworks out in the valley? You can't do it in town, and I know it is a huge economic boon, and everybody and their dog's got a fireworks stand. State law currently precludes counties from declaring a moratorium on fireworks in the county boundary. Each county. The city can, the county can't. I would like to, and I'm beating on the drum right now and planning on starting a campaign in our next legislative session to try to be supportive of all the veterans that live in our county and all the dogs and the horses and the wildlife that get run through the fences because they're terrified. Would you help with that, or how would I go about getting started on this project? I would like to get people so they recognize it is a problem.
Yeah, I agree that it's a problem there, and it's something we talked about for this 4th of July, because it was our first year having 24/7 coverage. And so the conversation there was making sure dispatch is aware, to think beyond the call coming and complaining about fireworks and offering crisis response team in case there's something more going on. They didn't end up getting any calls for that reason. And so one thing that we want to be better at next year is proactively putting some messaging out, right? That if 4th of July is bothersome to you in any ways, like we have resources that can help. And while we can't necessarily stop the fireworks, right, we can talk to people and help de-escalate and help strategies so that they feel more comfortable with what's happening.
And should this issue come before our friends at the legislature, would you, in your position, be able to, I suppose you would provide information, you couldn't support or deny it, but
We have a lot of veterans on our team, and so I imagine they would be more than happy to provide testimony on the effects of fireworks on 4th of July.
my father was a veteran of World War II. He came home with PTSD, and on the 4th of July, we stayed out at the ranch and did the hang, and we could have a sparkler maybe, but no firecrackers. So it is important, and not only to the veterans themselves, but to their families and loved ones who see their loved one going through this crisis.
Mhm.
So I would appreciate it if you would, and we have a potential legislator sitting in the back row there who I'm going to be putting pressure on to help with this. Thank you.
Yeah, thank you.
All right, any others?
Mr. Chair, Kayla and Sarah, thank you for bringing this really important grant opportunity for us. As we've been talking about in many of the meetings and stuff, I think just trying to get to the 24/7 level and then staying there is really challenging. So to provide this service to our community on a consistent long-term basis, huge challenge. And this is a great opportunity for at least for the next 4 years. And hopefully, I'm getting to a question here, but hopefully some of the billing opportunities will be enhanced by then. And maybe just so people understand, I think, Sarah, you mentioned it really quickly in your presentation, but we're talking about this Crisis Now model, which we want to place for people to call, somewhere for them to call, someone to respond, which is the crisis response team, and then somewhere to go. So this fits in that puzzle in terms of that crisis response model. And maybe just explaining a little bit about how this works. So this is a partnership city or county and St. Pete's, which thank you to St. Pete's for taking this on. Really appreciate that. And there's a bunch of other partnerships in the community as well, but kind of just how it works. Someone is in crisis or a family member's in crisis, they call 988 or 911.
Yep, either.
And how that kind of works, and take us through a scenario real quick.
Yeah. So we ultimately find out someone is in crisis one of two ways. So either we get dispatched out by 911, and that could be because a caller comes in, they recognize the crisis, and everything through our dispatch system goes through the officer in charge, the OIC, and they might say attach CRT, or maybe, attach this unit and CRT. So we get attached to calls. Or some community partners have the direct phone number. So PureView, for example, if they have someone in crisis, they can call the phone number directly. We still create a call for service record with 911, but it's a more direct access, assuming we're not on a call. So we get notified, and then our team responds to the scene of that crisis, wherever that's located. Sometimes it's on the side of Highway 12. Sometimes it's in someone's home. Sometimes it's at the library. They will respond to any location. Once the scene is deemed safe, law enforcement will leave, but they're aware where crisis response team is, right? Because we don't carry weapons or anything like that. And so if a situation comes up, we have a way to contact them and get help and backup on scene. Luckily, that doesn't happen very often. So we spend as much time as we need on scene with them. We do a crisis assessment. We de-escalate them. We help figure out maybe some resources that can help support them. And ultimately, our therapists make the recommendation of what next steps look like. And so sometimes that's someone going voluntary to the emergency department with the goal of seeking inpatient treatment. And so we're not going to bring someone to the emergency department unless they need to be placed in our behavioral health unit, or maybe there's some contributing factors and they need to have, some medical attention. Or they're going to remain in the community, or they might go to Journey Home. And so the goal is to keep most people in the community if that's clinically safe to do so. And we are able to resolve most of our calls in the community. The next level of care would be Journey Home, especially once they're open 24/7. And then from there, it would be the emergency department only for a medical clearance, and then to the behavioral health unit, or if you're youth, to Shodare or a surrounding facility of parents' choice. But really, most of our calls are able to remain de-escalated in the community. And then we are able to provide a limited number of follow-up, because right now the team doing follow-up is the same team responding to crisis. And so if there's a slower day, then they have more ability to call the people from the previous week that they checked in on. Part of this grant would get us a dedicated case manager to work Monday through Friday, 9 to 5, where their whole job would be completing that follow-up, which is really critical in the next step there.
Mr. Chair.
Yes, go ahead.
Thanks. I was hoping you were going to get to that, because that's really important, like what happens next. So I know that the whole point of the crisis response team is to respond to the crisis that's at hand, but many of these folks will have need of care beyond that. And so whether that's, immediate care like hospitalization is the one extreme, to a family member taking them home or something like that to the other extreme. But many of them need follow-up. So there'll be case management to refer them to maybe Fuse or maybe another community program that might be benefit to them to help them stay stabilized.
Or even, helping them get to food share or whatever that next step looks like. So what are things that are contributing to their situation, that are contributing to crisis, and how can we help remove those barriers so that they can access the mental health care they need, and how do we help them through that next step?
Thank you. Thank you, Mr. Chair. Happy to support.
Commissioner Payne.
You alluded to the Journey Home as a place to take people who need time off. However, it's my understanding the Journey Home is only open like commercial business hours, like from 9 to 5 or whatever. And there are a lot of crises that do not happen based on business hours. In my former life, I had dealings. St. Peter's Hospital has I don't know if it's called the mental health unit or what it is up there, but we had people taken up there, and they were given 24-hour, 7 days. They were taken care of. Does that opportunity still exist at St. Peter's?
Yes.
So if Journey Home does not be able to staff and provide assistance for 24/7, it isn't like we don't have another option. St. Peter's is there for us. Is that correct?
That is correct. And so there's some nuance there. So Journey Home, I believe, now is open most days till midnight, which is a great addition, but we do need to get it to 24/7. I agree with you on that. I can also say that as someone who recently figured out how to staff a 24/7 team for the first time in my life, it's a complex factor. So I empathize with them and what's going on with their staffing. The thought of Journey Home versus the behavioral health unit at St. Peter's Health is not apples to apples. And so the way we should think about Journey Home is really in lieu of the emergency department, right? So right now people do come into the emergency department and they wait around until they're maybe clinically sober, if they're intoxicated or whatever they need to do. They're medically cleared so they can have a mental health evaluation. And then from there, we determine whether they're safe to go home or whether they need inpatient psychiatric admission, which would be our behavioral health unit. The emergency department is not the best place for someone experiencing mental health crisis to seek care from the standpoint of helping their mental health symptoms. And that's not a St. Peter's Health thing. That's a nationwide thing that we're up against. And so in the Crisis Now model, the crisis receiving facilities, so like Journey Home, would be essentially the emergency department for people in a mental health crisis. Now, there are situations where maybe they are coming off of a suicide attempt and they need medical care, so they should be at the emergency department and not a place like Journey Home. So we would think of Journey Home as a location where we would bring people to, and if they don't stabilize within the first 23 hours and 59 minutes, then they would, hopefully the plan is to have them get directly admitted to the behavioral health unit. So you almost think of Journey Home as like the mental health emergency department, right? And then inpatient would still be at St. Peter's Health if we had a bed available.
A bed available 24/7,
Yeah,
not
so
just during the tea time, right?
right. And so this is once Journey Home is 24/7, but per like the limitations of what a crisis receiving facility is, you can only stay for 23 hours and 59 minutes. And so somewhere in there, maybe it's the 16-hour mark, maybe it's the 20-hour mark, right? Journey Home will recognize, okay, this person is not going to be stabilized and safe to go back home. They'll need a higher level of care. And so at that point, they would work with our behavioral health unit to admit them for a longer term stabilization period. Maybe that's a week, maybe it's 5 days, whatever is needed to be medically managed.
Thank you. It's as not part of the system, it's hard to understand how this whole works. And I know St. Peter's does a good job with people in crisis. So I needed a better understanding of what part Journey Home plays in this system of making sure people have adequate care.
Yeah.
Thanks.
Absolutely. The way I like to explain it is like so you can think of the Crisis Now model in comparison to the medical model we're all familiar with, right? 911 is 988. So those are the same, but for mental health. In a health emergency, an ambulance will come out. In a mental health emergency, the mobile crisis response team will come out. They'll then decide whether you need a higher level of care, right? If it's a medical, ambulance will take you in. If it's mental health, our mobile crisis team will transport you in. And then where you go, so in a medical emergency, you would go to the emergency department. In a mental health emergency, you would go to a crisis stabilization or receiving facility, which would be Journey Home. And then in the emergency department or the crisis receiving facility, we make some further assessments and determinations. And from there, you would either go home or you would be admitted like medically if you're having a medical emergency, or admitted psychiatrically if you're having a mental health emergency.
Thank you.
Yeah.
Question for Sarah. It would appear that you're going to use St. Peter's as an example to be a subrecipient on this particular grant if we get it.
Yeah, thank you, Mr. Chair. Great question. The county is required to be the applicant. St. Peter's can't apply directly. As the current procured provider through an RFP that we did a few years ago, we would hope to work similarly since the RFP is very similar that it would be. So it would be a procured contract and we would work with our procurement department on it.
Okay. And then would there be others? For instance, could part of the money go to the Journey Home for its attempt to get to 24/7?
Yeah, that's a great question. This one's specifically for mobile crisis response team, the notice of funding opportunity. So it's not just a general crisis system because then we would be able to. This one's specifically for crisis response.
Okay.
Thank you.
Any other questions? Any other questions? Now, seeing none, do we have any public comment? Any public comment? I see no public comment. Do we have a motion?
Mr. Chair, I move that we approve action item 3A, the grant application to the Substance Abuse and Mental Health Services Administration as presented by Sarah Sandau. Thank you.
Second.
We have a motion and a second. Is there further discussion from the commission? Any further discussion from the commission? Seeing none, we'll move to a vote. All those in favor of approving the grant application to the Substance Abuse and Mental Health Services Administration as explained by Sarah Sandau, please say aye.
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 Opposed, same sign. Motion passes unanimously. Next item on our agenda is Resolution 2026-63 to levy and assess the Broadwater Estates Rural Improvement District number 2004-4.
Good morning, Chair Ralph, Commissioners. My name is Jessica Makis, Special Districts Coordinator for Lewis and Clark County. Today, you will be holding public hearing to hear comments and objections regarding the final adoption of a resolution to levy and assess an annual special assessment of $345 upon each benefiting property within the Broadwater Estates Rural Improvement District. With a total of 72 benefiting properties, a total of $24,840 will be assessed annually to fund maintenance of the RID. The Broadwater Estates RID was created in 2004 to maintain the road network within the Broadwater Estates subdivision. This is located off Highway 12, just behind the Broadwater Hot Springs area. Maintenance provided by this district includes snow plowing, sweeping, drainage control, signage, surface treatment such as chip sealing, and other maintenance as necessary to preserve improvements. The maintenance assessment has been $300 per property per year since 2023. However, the district is projected to have a shortfall of $7,500 for the next chip seal cycle scheduled for 2028. An increase to the assessment will ensure annual maintenance in Broadwater Estates RID can be completed as detailed in the resolution that created the district. This is a total increase of $45 per property per year, for a total assessment of $345 per property per year. An evening meeting was scheduled to discuss the increase with residents at the Baxendale Fire Station on June 11th, 2026. Legal notice of the increase in the public hearing was sent to all benefiting property owners and published in the Helena Independent Record on June 20th and June 27th, 2026. As of this morning, no written testimony has been received. Staff recommend approval of the resolution to levy and assess the district, and I'm happy to take any questions. Thank you.
Any questions from the commission? Any questions from the commission? Do we have then any public comment? Any public comment? I see no public comment. Do we have a motion?
Mr. Chair, I'd move that we approve Resolution 2026-63 to levy and assess the Broadwater Estates Rural Improvement District number 2004-4 as presented.
Second.
We have a motion and a second to approve Resolution 2026-63. And I just want to see if we have any more discussion from the commission. Any on the motion? Just one comment I'd like to make. It looks to me that you're doing your normal great job of checking to make sure that the money is there to take care of things like this. And when there's a shortage and there's a need, we need to increase it. Sometimes we have a little extra money and we're able to decrease the assessment, but in this case, we've got a small increase.
Chair Ralph, that's correct. So staff analyze these budgets every year. We look at those annual maintenance items such as sweeping or pothole patching or crack sealing or those things that are done every year. And then we also look at that less frequent, higher cost item such as the chip sealing. And as we look to that cycle, we want to make sure that we have adequate funds so that we can stay on that maintenance schedule as intended in the resolution that created these districts. Once we get beyond, if we let that maintenance defer for too long, we can't bring those roads back up to that high standard. So that is the goal.
All right. Well, thanks for staying on top of them. What is there, 150 or more districts? Appreciate that.
Thank you.
Any further discussion from the commission? Any further discussion? Seeing none, we'll move to a vote. All those in favor of approving Resolution 2026-63 to levy and assess the Broadwater Estates Rural Improvement District number 2004-4, as explained by Jessica Makis, please say aye.
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 Pose same sign. Motion passes unanimously. Next item on our agenda is Resolution 2026-64 to levy and assess the Skyview Rural Improvement District number 2008-9.
Thank you, Chair Ralph. Commissioners, my name again is Jessica Makis, Special Districts Coordinator for Lewis and Clark County. Today, you will be holding public hearing to hear comments and objections regarding the final adoption of a resolution to levy and assess an annual special assessment of $240 upon each benefiting property within the Skyview Rural Improvement District. With a total of 125 benefiting properties, a total of $121,440 will be assessed annually to fund maintenance of the RID. The Skyview RID was created in 2009 to maintain the road network within the Skyview subdivision located off North Montana Avenue, north of Lincoln Road. It's a little bit busier on our map here, but we can see this highlighted in blue on your map before you. Maintenance provided by this district includes snow plowing, sweeping, drainage control, signage, surface treatment such as chip sealing, and other maintenance as necessary to preserve improvements. The maintenance assessment has been $186.91 per property per year since 2009. However, the district is projected to have a shortfall of about $33,000 for the next chip sale cycle scheduled for 2031. An increase to the assessment now will ensure annual maintenance in the Skyview RID can be completed as detailed in the resolution that created the district. This is a total increase of $53.09 per property per year for a total assessment of $240 per property per year. An evening meeting was scheduled to discuss the increase with residents at the West Valley Fire Station on May 20th, 2026. Legal notice of the increase in the public hearing was sent to all benefiting property owners and published in the Helena Independent Record on June 20th and June 27th, 2026. As of this morning, no written testimony has been received. Staff recommend approval of the resolution to levy and assess the district, and I'm happy to take any questions. Thank you.
Are there any questions from the commission? Looks like another good job of staying on top of the costs on an individual rural improvement district. And as you've explained before, that money doesn't go into a general pot. It goes just for that district. The money that's collected from the people in that district stays in that district and is used only in that district. And so when it's short, we have to take a look at raising it. If there's extra, we can reduce it.
Chair Ralph, that's absolutely correct. Each of these 150 or so rural improvement districts are managed independently. Each has its own fund number. And when those assessments are collected through those tax bills, those assessments go into those specific rural improvement district funds. Those funds can only be used for those items set forth in the resolutions that created the districts. Those funds roll over from year to year. They gain interest. That interest is also held within those individual accounts. And that's how they go. So we do our best to project when we see a shortfall. And like you said as well, when we see a growing cash balance beyond what is needed for maintenance, that's when we can also consider a decrease. So it does go both ways. It's not intended to be a savings account by any means.
Okay. Any other questions? Yeah.
I'm not sure this is a question, but a nice thing happened. I was at some social function, and I think he used to be a reporter for the IR, but I knew him years ago. He came up to me and said, I had the darndest notice from your public works department. And I'm thinking, oh, Lord, here we go. Increase in taxes. He said, no, my taxes went down. And it was this rural assessment that you're doing, and you had plenty of money, so you cut back. And he was just tickled, and he was telling everybody at the party that they cut my taxes. Can you believe it? And I just thought, I told him there's this lady named Jessica Makis, and she is the bean counter down there and knows how to get this done. So
that's great. Thank you, Chair Ralph, Commissioner Payne. I appreciate that. And I do just want to take a moment just to also acknowledge our staff. behind the scenes as well. You see me up here a lot, but we have Conrad Bentley, who's here today. He's our RID construction coordinator. We have Brent McCula, who's a construction coordinator, also split between the road department and the RID program. And we also have Jade Wills, who's our administrative assistant, who formulates all of those legal notices for us, which is a huge effort. So it's a great team responsible for it, and happy to provide that service.
If there's no further questions, we'll ask for public comment. Is there any public comment? Is there any public comment? Seeing none, do we have a motion?
Mr. Chair, I move that we approve action item 3C, the resolution 2026-64 to levy and assess the Skyview Rural Improvement District number 2008-9 as presented by Jessica Makis.
Second.
We have a motion and a second. Is there any further discussion? Any further discussion? Seeing none, we'll move to a vote. All those in favor of approving Resolution 2026-64 to levy and assess Skyview Rural Improvement District number 2008-9, as explained by Jessica Makis, please say aye.
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 Opposed, same sign. Motion passes unanimously. Let's move on to Resolution 2026-65.
Okay, thank you, Chair Rolfe. Commissioners, my name again, Jessica Makis, Special Districts Coordinator for Lewis and Clark County. Today you will be holding public hearing to hear comments and objections regarding the final adoption of a resolution to levy and assess an annual special assessment of $290 upon each benefiting property within the Wheat Ridge 3 and 4 Rural Improvement District. With a total of 76 benefiting properties, a total of $22,040 will be assessed annually to fund maintenance of the RID. The Wheat Ridge 3 and 4 RID was created in 2018 to maintain the road network within the Wheat Ridge Phase 3 and Phase 4 subdivisions located west of Spokane Creek Road, just south of Spokane Ranch Road, all located kind of north of Highway 12 if we zoom out here. Maintenance provided by this district includes snow plowing, sweeping, drainage control, signage, chip sealing, and other maintenance as necessary to preserve improvements. The maintenance assessment has been $227.26 per property per year since 2018. However, the district is projected to have a shortfall of around $17,000 for the next chip seal cycle scheduled for 2029. An increase to the assessment will ensure annual maintenance within the Wheat Ridge 3 and 4 RID can be completed as detailed in the resolution that created the district. This is a total increase of $62.74 per property per year for a total assessment of $290 per property per year. An evening meeting was scheduled to discuss the increase with residents at the Tri-Lakes Fire Station on June 4th, 2026. Legal notice of the increase in the public hearing was sent to all benefiting property owners and published in the Helena Independent Record on June 20th and June 27th, 2026. As of this morning, no written testimony has been received. Staff recommend approval of the resolution to levy and assess the district, and I'm happy to take any questions. Thank you.
Are there any questions from the commission? Any questions from the commission? Seeing none, we'll ask for public comment. Is there any public comment? Is there any public comment? I see no public comment. Do we have a motion?
Mr. Chair, I'd move that we approve Resolution 2026-65 to levy and assess the Wheat Ridge 3 and 4 Rural Improvement District number 2018-2 as presented.
Second.
We have a motion and a second to approve Resolution 2026-65. Is there any discussion from the commission?
Mr. Chair, just like
Commissioner,
thanks to the team as well. Appreciate it. Waited till the end here to do that, but great work. And you can tell by the number of people in the room having issue with these changes or increases as a indicator of how great of a job you guys have done in informing them and making sure people understand why and how and what's going on, answering questions prior to this time. So thanks a lot for your good work. Thank you,
Yes,
Mr. Chair.
got a great staff there. Any further comments? Let's move to a vote. All those in favor of Resolution 2026-65 to levy and assess the Wheat Ridge 3 and 4 Rural Improvement District number 2018-2, as explained by Jessica Makis, please say aye.
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 Pose same sign. Motion passes unanimously. We've arrived at that point in our deliberations at the completion of all the action items where we offer an opportunity for the public to bring issues forward that are under the purview of the commission, but not on today's agenda. Is there any public comment? Is there any public comment? Seeing none, we're adjourned.